professional. Oh, 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 oh. A chat with a professional. With smiles and so good. A chat with a professional. Oh, 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 oh. A chat with a professional. With smiles and so good.
Do you think that Baba Obasanjo could be on the stage while these Boko Haram people are doing what they are doing?
The objective of the private organization is slightly different from...
Nigeria is the most important country
for education. The collapse of culture in Nigeria. Even with cheating, we can't pass. We've not done enough. There's still more. Join us.
And you'll never regret that you did.
Now, for so long we've talked about medical tourism, and for so long we have lamented about how particularly our political office holders have squandered our lean resources traveling overseas for medical checkups or medical services. For so long also we've had healthcare providers and professionals lament about inadequacies in terms of equipment, of course, a terrible work environment, to do the needful to ensure that Nigeria is also on the map of a good health care provision countries. Now, all over the world we have many Nigerians practicing in the developed societies, and of course a lot of them are renowned to be the best in their own chosen fields. How come that in Nigeria we are not able to do what we should or what we ordinarily do when we travel abroad? Today on A Chat with the Professional, we are going to be having someone whom I have featured once on this show, someone who has seen it all. He practiced in Nigeria before traveling overseas, and this time around he's thinking about coming home, bringing back home all those facilities and of course practice that he has going for him in the United States of America, to see how we can turn things around and have Nigeria as one of those countries where you can embark on medical tourism, just like we do to India, to the United States and Europe. So I'm going to take a short break. By the time I return, I will probably be introducing my guest, who definitely will be discussing this and lots more. Please stay. You're still watching the show A Chat to the Professional. Today, once again, we are looking at health services, and we are looking at healthcare provision on the continent of Africa, but we are focusing on Nigeria. And we have a gentleman, someone who has paid his dues in the medical field. Of course, I featured him on this show before. That was about 4 years ago, where he talked about his practice in Nigeria and his practice in the United States of America. Of course, he's done nearly 3 decades as a medical practitioner in the United States of America. But this time around, he has decided to bring back home what he has seen overseas. And that's why today it is my delight once again to have on the show Dr. George Ego Osuala. You're welcome.
Thank you very much.
Now, nearly 4 decades as a medical doctor, what would you say inspired you to begin to think about bringing home a facility that would provide the kind of services that can be obtained elsewhere in the developed societies?
Thank you very much. I will take the first part of your question, which is emotion part. And I decided to take this journey. I can tell exactly the date. That was in 1993, on the 20th of December. On this day, I was working in the emergency room in Woodhull Hospital in Brooklyn. I was actually moonlighting. And I was taking care of a patient who was having a heart attack. The patient survived. The following morning, I got message that my own mother died. And I asked questions, what happened, what they did, what she complained about. It turned out she died of an inferior heart attack. I was out there, I took care of my own patient, but my mother died down there, no one to help. There was just nothing. When I discussed with the doctor, unfortunately, due to the paucity of quality health care and of course people in the village will always think about what is very close. No one knew, had any diagnosis, but from far out across the oceans, I knew what was wrong. That was when this whole idea started. It wasn't easy. I grappled with it because it was a project I felt I couldn't handle. But down the road, realizing the words of Mao Zedong, the journey of 3,000 miles starts with the first step, I decided to put something on the drawing board and move on. And today, thank God, it's being real. It's getting very real and will soon be practical.
Your first 2 decades of practice you mentioned was in Nigeria. And I remembered back in 2012 you telling me that you wondered how your patients survived while you were still in practice in Nigeria. Now, having done another roughly 2 decades in the, or over 2 decades as it were, in the United States of America, how do you think that you can get back home and begin to do what you do in the developed society and be able to succeed given the local environment, of course practitioners who probably do not have the same kind of training or work environment like you do in the United States of America?
Well, yes, I remember what I said and I remember everything vividly. And it still marvels me today how I was praised, hailed, but when I came out here, I remember wondering, that was God at work. I was actually doing nothing. When I saw how things changed, maybe that was because different styles, that you have so many ways of killing a rat. That might be one of them. But be it as it may, I have tried to come back home to join the group there. They're all well trained and very good doctors. But I found out that I couldn't really bring down whatever I have learned here because of the unavailability of diagnostic paraphernalia. It's not that the knowledge is not there. The knowledge is there. But what to use to practicalize, to get the knowledge to be useful, put into real reality, it's not really there. So that makes practice of medicine a little deficient. And all this also came in to push me on to try to do something different and see how much you can help. On the issue of helping, each time I came home, I would lose one friend or the other. And what happened when I ask, I'll find out it's just because certain things were not available. And that's why that person had to pass on. So all this started adding on to me, to what I had to do. And even though I've gotten to this stage, I still feel there is still a lot to be done. And I wish others will come in and take on these other aspects and set up things at different places so that our people, we can have something to give back to that community. To say, yes, we went out, we imported some knowledge and we've brought it back to you people. That is my prayer.
Now, you've mentioned all that you intend to do in Nigeria, but are you encouraged that the local practitioners, by this I mean, of course, your colleagues in the Nigerian Medical Association, will be able to give you the kind of support that will encourage standards as you're trying to set on the facility?
Now, that's a very good question. And I've thought about it. and I know what our environment is like. But if we all realize that as professionals, as medical doctors, by the Hippocratic Oath, which we all took, our life should be dedicated to our patients, and then our patients should be our main concern. All of us will have the same goal. We may not have the same pedestal to be practicing or doing our own things, but we are expected to share knowledge all the time. So if all of us will go along this line, I don't think there should be any friction, but there is never 100% in any situation. There might be friction here and there, but just with some explanation, things might work out well. I've tried to send my feelers out in this direction, and I've tried to get in contact with my classmates who graduated with me at the University of Nigeria in 1976, and they've all been welcoming. They've been happy, and then some have visited my site, my location, and then I very much think that with the services available there, which are very scarce in the whole of the southeast, I'm always open. They can always send in their patients there and get any investigations they want, as long as they are the equipments are functional, which I promise I'll keep functioning. We'll help. Our goal is to help our people, and that's all. I don't want to look at the negative. I just want to stay positive all the time.
I chat with a professional. Oh, 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 oh. I chat with a professional. When smart is all wood. I chat with a professional. Oh, 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 oh. I chat with a professional.
Do you think that Baba Obasanjo could be on the stage while these Boko Haram people are doing what they are doing?
The objective of the private organization is slightly different from...
Nigeria is the most important country
of education, the collapse of culture in Nigeria. Even with cheating, we can't pass. We've not done enough. There's still more. Join us.
And you'll never regret that you did.
What are we going to be expecting on this facility that is completely unique or new to the environment where you've situated the Edge Medical Center? Now, I'm talking about Owerri and environs, or if you like, the entire southeast region of the country.
Thank you once again. It marvels me how much the facility grew. I started as just to do one small clinic, but each time I returned, things changed, and I continued to expand it. This facility has a lot of services it can provide to my people. I have a 24-hour emergency room, a building for that. It has a 30-bed inpatient. From what I've learned overseas, each bed is housed in its self-contained room. My whole aim was to make this hospital a home, not a hospital, so that a patient does not feel sick, feels he or she is still in a home and feel comfortable. So this is a homely hospital and serene. That's my dream of a hospital. And I wanted to make it a multum in powerful, much in small. It is small, but it has this 24-hour emergency room service, and then it has a 30-bed, has its own outpatient, has its own full laboratory services on site,
Wow.
has its mammography, because 1 in every 9 women will develop breast cancer. It's worse in the third world. Nigeria is one of them. So we even have a lot of it. Screening will help. I have the mammography there. I have the sonograms, diagnostic equipment. I have, whether the facility also has an MRI, and it's a functional MRI. The CT scan is in the queue. It's coming now, and a 12-chair dialysis unit. These are all on the ground, waiting to take off when the hospital will be commissioned. There are other services, but as time goes on, as well, the interview continues, I might run into them, but the highlights are just the ones I mentioned.
Do you have enough manpower to take care of this equipment that you've mentioned? I mean, yeah, having the equipment is one thing, but being able to operate them, do you have enough manpower in Nigeria to take care of this?
No. I'm not a one-man do-it-all. That process is in the works now to employ people who can really man these equipments. I will not say I can man all of them. We have the MRI. Thank God for the superhighway, the internet.
Yeah.
The plan for Edge Medical Center is where we don't have the manpower. The equipments here are digital. The information will go through the superhighway to the professionals outside where I need interpretation. I will not arrogate to myself where I did not have the full training. I will not attempt it.
Of course, we are not expecting you to be to run a one-man show or to operate all this equipment by yourself, but my concern here is if we have enough trained personnel in Nigeria to handle this equipment.
Well, I don't see adequate manpower. I will have no other option, because only the best is good for the people of Imo State and Nigeria at large.
You know, you just mentioned you're going to be providing 24 hours services. And I'm wondering, are you going to be having resident doctors and other healthcare professionals who will reside on the facility to provide this 24 hours service, or are you just going to rely on, you know, people running shifts? I mean, how do you intend to achieve this?
Now, I have quarters for doctors.
Okay.
At least one doctor will live on site.
Okay.
And as my diagnostic equipment are open to accepting referrals from doctors outside,
Yes.
I have a place for imaging staff where they can live. We never know when the kidney is failing and is critical that there must be the dialysis. I have a place for the dialysis technicians or nurse, so that these things that are emergent, that there's always somebody around. Let's say it's off hours at night and we must have an MRI. The technician will be around to do it. And as I said earlier, everybody will be asleep. The information goes through the superhighway. Remember, Nigeria is 6 hours ahead of the United States and it's about 9 hours behind India. So when people are asleep in Nigeria, in the United States it's daylight, India is even morning. So there's always somewhere to get the result right back. So these have all been factored into the planning. It is the execution, and currently I'm looking at all the applications that have come in to know who, and I'm putting this into consideration as I do my shortlisting for interviews.
Now, when will this facility become operational?
I'm looking at late November for the initial running. Then official commissioning will be in about 3rd week of December. Precisely at this time, tentatively about December 22nd.
You just mentioned 22nd of December as the day for the official commissioning, and I'm wondering, do you have special programs, designed for that day? Are there things that specifically whoever is attending this function should expect?
Now, December 22nd is official commissioning.
Okay.
And I will want to, being a diasporan, I live here in the United States. I've been here for 25 years. It's time to go back. It's time to give back. And I expect other diasporans to go this route too. Beautifully enough, the president has an area for the diasporans. I'm trying to see how I can tap into this so that this will give the avenue for that message to go out, that the country needs these diasporans to bring back. You see, India, we now carry out, we have medical, what do you call it?
Tourism.
We always go to India for everything. That Apollo hospital was started, I don't have the name of that doctor, by a doctor, an Indian doctor who trained in Britain. Now I have been there, one of them, because there are 66 sites. I've been to the cancer area in Chennai, and I had time to discuss with them. It's time the diasporans did it. It's the Indian diasporans who did that.
Yeah.
We look at Singapore. When Singapore was nowhere, it was the diasporans. It is now time for diasporans to come together. Here in the United States, the whole world now knows about www, the internet. The concept of internet was brought to life. Is the brainchild of a Nigerian, Emma Wale, and Okaman. Now he's been stolen away. We don't even know that we enjoyed the internet, but it was a Nigerian. Clinton mentioned it when he came to Nigeria. He said it. Now, come in here. All our children are doctors. There is no institution you will go into, you will not see a Nigerian doctor, nurses. But back home, some states do not have even one consultant in any discipline. But we have all of them. People who operate on the head and the neck, chest surgeons, transplant, Nigerians. We are all in the diaspora. The diasporans anyway have their own giving. Out here, it is not easy to save. I wouldn't say the government should give you money to do anything, but an enabling environment where out here security is so good, but back there, once we don't have the security and you can't stand the power fluctuation, that's it. The next thing is you stop. Power fluctuations will destroy the equipment, so it's an added burden to get it. So once this can be gotten in place, diasporans, I'm quite sure this move will bring in a lot of diasporans. So coming back to your question, will there be an event that day? Yes, I'm looking forward to it, and I'm planning to attract the federal government, attract the state government, so that they will come and see this.
Okay, Dr. Osuala, in a nutshell, what would you in 30 seconds be telling the people within Owerri and environs regarding this facility?
I will ask you to pray. I believe in the Almighty, to pray for me, and pray that all my dream about being able to meet your aspirations, that God grants that. My aim and goal is to satisfy you.
Once again, Dr. Osuala, it's been my pleasure having you on the show to talk about healthcare and of course medical service provision, now that you are trying to bring back home what you have been doing overseas for many years, running a successful chain of clinics in the United States of America. Thank you.
You're welcome.
Well, that's much time would permit on the show Chat to the Professional today. You will agree with me that we need lots and lots of more Dr. George Ego Osuala. In Nigeria, we need a lot more professionals who will come home and bring back to us, like he said, what the Asian tigers have done over the years, using the diasporans to improve on the quality of services in their own country, and by extension, improve on the economy of those countries. We need a lot more Nigerian professionals in diaspora to come home and bring home what they have experienced overseas, so that we too can be like those countries that our folks run to for either services or for practice. Till next week when I come your way, I remain Martin Sobu saying stay blessed, and I'll see you again.